Imagine a therapy for radiation cystitis that could achieve a 86.8% complete response rate. The great news is that a 2017 study by Dellis et al. Of 38 people showed that is just what HBOT is doing, and that is with patients with severe haematuria, which is blood in the urine. But first, what is radiation cystitis? Radiation cystitis is inflammation of the bladder lining, a side effect of radiation therapy for pelvic cancers like prostate, cervical, rectal, causing urinary urgency, frequency, pain, burning, and blood in urine, which is known as haematuria, which can be mild or severe, appearing during treatment or months or even years later. It's managed with typically medications, lifestyle changes, or advanced therapies like hyperbaric oxygen therapy for severe cases. What are the causes of radiation cystitis? Radiation therapy to the pelvic region, such as bladder, prostate, uterus, rectum, which damages healthy bladder tissue. It can be acute within 6 months or even delayed months to years after the treatment. Some of the symptoms include urinary changes, meaning you have frequent urination, the urgent need to go, feeling of incomplete emptying or pain, burning during urinating, which is labeled as dysuria. Another symptom is finding blood in urine, known as haematuria. It can range from microscopic to visible blood, sometimes forming clots. Blood clots are something you may be familiar with, and these can cause further medical issues, such as when they completely block blood vessels or cause strokes, just for some examples. Pelvic discomfort, which can more specifically be described as pain or pressure in the lower abdomen. Incontinence, which is difficulty controlling urine flow. Mild cases do have a way to be managed and treated, which often resolve or manage with anti-inflammatory drugs, hydration, and dietary changes. For more severe cases, which would be called hemorrhagic cystitis, the following are some ways to treat and manage them. Bladder irrigation, which is washing out blood clots in the bladder. Hyperbaric oxygen therapy, or HBOT for short. This is where oxygen under pressure is used to promote healing. Intravesicular agents. These are medications instilled directly into the bladder. Cystoscopy, which is a laser treatment to stop the bleeding inside the bladder. One last option is by having surgery, which is usually saved for when this medical issue is unable to be resolved by other methods. Now, getting back to the wonderful results seen in the study by Dellis et al. This paper is entitled, quote, Hyperbaric Oxygen as Sole Treatment for Severe Radiation-Induced Hemorrhagic Cystitis. So these are really severe types of cystitis. The results of this study were that all patients completed therapy without complications with a mean follow-up of 29.33 months, and the median number of sessions was 33 sessions. Complete and partial response rate was 86.8% and 13.2% respectively. All 33 patients with complete response received therapy within 6 months of the haematuria onset. Again, haematuria is the blood in the urine. The Dellis study had an average of 32 HBOT sessions with a range of 27 to 44 sessions needed. These sessions, which we call dives, were done on a daily basis, so that'd be like Monday through Friday. Through this study, HBOT has been shown to be cost-effective for treating radiation cystitis. Also, HBOT treats both bleeding and lower urinary tract symptoms associated with radiation cystitis. In summary, if you or someone that you know is dealing with radiation cystitis, there is strong evidence showing that HBOT should be the primary therapy for this condition. Further, if possible, it's best to start the HBOT within 6 months of when the radiation cystitis begins. We hope this information has been a great help to you. If you have any questions, please feel free to leave those in the comments section below. Also, if you have any suggestions for future topics, you can leave those in the comments section below. To learn more about our clinic, see our website listed in our description below. As always, it's been a great pleasure to talk to you today. I look forward to talking to you on our next video.